morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXVX. Paul Thomas and Bill Kearney in the studio on another pre-recorded adventure.
Yes,
and this should be the last one.
This should be,
yes.
Yeah. We may not even get to use this one if you're still in town.
If I'm still in town and not up in the snow of the Sierras, which as of today when we're recording this, they got a bunch of snow.
They did.
Whether or not 3 weeks from now they'll still be getting snow or have it up there will be yet to be seen. But yeah, a pretty good storm, and the forecast said there was going to be snow here in Lakeport at lake level. That never materialized.
It's all around all the mountains. We discovered just coming down from where I live over by Konocti Harbor Inn. All the mountains around there are they're probably up another 200 feet from where I live.
Yeah.
But plenty of snow up there,
sure.
And I'm sure Cobb had plenty. And I was hoping for a little bit more rain. Thought we were going to get some more, but enough that there's a little bit of water running into the lake, but not very much.
Not a lot.
So hopefully they'll follow up. There's another storm coming in, I guess, next week sometime, and whether or not that's when I left my house this morning, it was 31 degrees.
Yeah, it was cold overnight.
And the rain started coming, about really coming down hard about 6 or 7 o'clock, and lasted for quite a amount of time. So, but I look in the paper today, and it didn't show that we received that much.
Yeah.
Less than an inch, but every little bit helps.
Sure.
And that way you don't have to turn the sprinklers on for another month, maybe.
You're right.
But we're going to still talk about your health, and one of the things that is going around with this flu is a cough. And unfortunately, it doesn't just stay with the adults. It happens with kids, too. And we get more and more questions from people about alternatives to opioids for kids, because we used to prescribe Tylenol with codeine cough syrup or promethazine VC or Tessionics, which is supposed to be adults for 18 and older, and we rarely use that at all anymore. There's no really good evidence that these things work in kids. There are clear risks, though, that should, in fact, be told about the warnings and respiratory depression and misuse and abuse for meds in all ages of these patients. But these are still narcotics. These still affect respiratory rates. These still, if they affect adults, and respiration and breathing, they're going to affect kids even more. This adds to warnings over the years about using codeine or tramadol in kids for cough or pain. It's partly because kids can develop opioid toxicity because they are rapid metabolizers of some of these drugs. Excuse me. So when somebody comes in and asks me, what do I do for a 6-year-old or a 12-year-old, a 6-year-old, we kind of tell them there's not really anything that you can do. Fluids, cool mist humidifiers, a couple of teaspoons full of honey in kids that are over the age 1. You don't want to use it in children under the age of 1 because it can set up a medium to grow bacteria. Excuse me, to grow bacteria, and then they could go into pneumonia. So there are options that you can use with kids if they aren't improving and coughing after about a week. We suggest Mucinex, which is a form of a drug that breaks up the congestion that's in your chest and gets it out of there. You drink plenty of water. They also have one with dextromethorphan in it, which is a cough suppressant. But in these kind of cases, like the flu that we're having now, you want to get all of that exudate that you have in your lungs out of there so you can fill those lungs full of air. There is a difference also in kids when it comes to treating them for pain. We always recommend acetaminophen or Tylenol. and ibuprofen for most pain, including dental pain. Yesterday, I just got 2 prescriptions for 2 kids. One was 11 and one was 9. And for ibuprofen for children, 100 milligrams per 5 cc's. And for the 9-year-old, it was 1 teaspoonful, meaning 100 milligrams every 6 to 8 hours is needed for pain. And for the 11-year-old, it was 2 teaspoonfuls, which would give them 200 milligram, which is the lowest oral tablet that's available that an adult can take also that's over the counter. That's as strong as the over-the-counter medication gets. But if you can possibly avoid an opiate with a child, unless they've been in broken a leg or been in an accident or something like that, you really should do it. And a lot of people think that it's advisable to alternate doses. I mean, there's no proof that giving ibuprofen one time and then acetaminophen the next time is any more effective than using just one of these things for pain. Now remember, and I tell people this all the time, I had a gentleman yesterday that got a prescription for Tramadol, because which is a distant opiate cousin of oxycodone and hydrocodone and those kind of things. And I tried to tell the person that had a hip injury that this is as effective many times as the hydrocodone. It is a non-Schedule II drug, but it is something that has the same kind of effects as an opiate drug would have. This is considered an opiate drug, a derivative of an opiate, and it works rather well, but it's still considered an opiate when it comes to the Board of Pharmacy and the Drug Enforcement Agency, but not in the same light as, because it's not as habit-forming, nearly as dependent on as the hydrocodone and the oxycodone. Avoid codeine with kids. Other opiates to be saved for severe pain, such as due to trauma, some surgeries, cancer, sickle cell crisis, which we don't see much of up here. We do see some morphine, instant release in these cases, and that may be extreme, but morphine isn't metabolized the same way that, and it's a lot more predictable than codeine or tramadol or oxycodone or hydrocodone. So the best appropriate initial treatment for most types of pain for a 10-year-old and 12-year-old is acetaminophen, just plain Tylenol. Now remember, and what I was telling this individual that got tramadol yesterday, when you take this medication, such as Norco or hydrocodone or tramadol, this isn't going to help you get better faster. This is only going to tell your brain that it doesn't hurt, or it will stop you from coughing. But as soon as you get off of that medication, that will return. And I told a lady yesterday that got both of these, a Tylenol type preparation and an anti-inflammatory. I said, you can take both of these if you want to. She was a caregiver, and her patient had fallen. And I said, because they work completely different. The ibuprofen is an anti-inflammatory. The ibuprofen will get rid of the inflammation that's causing the pain. The tramadol is just a pain medication that tells your brain it doesn't hurt, and when it wears off, then you have a problem of the same thing coming back. Now, sometimes time can outweigh that, and you may be taking it through the time that you would be getting better anyway, and you may think because you were taking the tramadol you got better, but you only alleviated some of the symptoms by taking that. With the flu, you see people trying to get all kinds of different drugs that are over the counter to help you. Elderberry and I can't even pronounce it. It's acetylocinium. It is a natural substance that is in minute quantities will develop a way to treat that drug or that disease. But it's due to a perfect storm of a record-breaking flu season and spot shortages of Tamiflu, and you don't want to use elderberry, and I have lots of people that are using elderberry. There's limited evidence that suggests that elderberry might reduce flu duration if started within 48 hours of symptoms, and I can tell you I have patients that will swear to that. It's not likely to harm, but products vary, and many don't come close to the doses that's studied, up to 22 grams a day. And we strongly suggest not making elderberry at home, syrup. The plant has a cyanide-producing chemical that can be toxic if not cooked properly. Cyanide is a poison. If you want to get rid of somebody, and if you ever watched some of these murder mysteries, cyanide is a way to do it, and you're putting yourself at risk by making your own syrup at home. Acecilium is homeopathic and has no measurable amount of active ingredient, and it doesn't seem to help or harm. There's a great amount of interest and criticism about homeopathic medicines. Those people that believe in homeopathy are very strong about the effects that they work. And how they work are micro dosages of the active ingredient that you're treating. So it's an active ingredient of the same virus that the flu is caused from. And through time, a lot of it is sublingual, through time it develops a resistance to that germ. And the ethical Western practice does not accept the fact that these things work. We sell drugs like that for leg pain, for RLS, restless leg syndrome, for pediatric use. So it's really something that you either have to go all the way in or just forget about it. And it's hard to realize that taking a micro dose of that medication is going to eventually end up curing. So we had a drug that we sold to people that were in the fire department and that were with PG&E and the telephone company that would get poison oak. And they would buy this capsule, and it was an extract of poison oak, and they would take this capsule or a series of capsules and they would develop an immunity to it. Now you cannot get it anymore. It's all being made for government use and commercial use, but not for the average person on the street, and it works. Also, high-risk patients that are pregnant or immunocompromised, or people that are under age of 2 or 65 and older with chronic conditions like COPD. These kind of viruses can attack them immediately and put them into a viral or bacteria pneumonia. You see the advertisements all the time on television for Pneumovax 23 or Prevnar 13. Those are both designed for elderly people. There used to just be one, the Pneumovax 23, and then they came out a couple of years ago with the Prevnar 13. So you need 2 shots to protect you if you're more susceptible to bronchial or lung infections like pneumonia, and you need them a year apart. So if you've only gotten one and it's been over a year, then you need to get the other one. Options to do with shortages of Tamiflu, which is starting to get back into the streamline again. There were so many people that were hospitalized, and And there are kids that we can make a suspension. We used to be able to make a suspension of. We can't since the State Board of Pharmacy decided that we weren't capable or dependable enough to make a compounding pharmacy anymore in the state of California because of a new regulation that just took place 2 years early in California, where we would had to remodel our compounding room. But you can dispense the capsules, and they can be opened and mixed with chocolate syrup if you can't get the suspension. And we ran out of the suspension early in the season, and it's still on allotment, so we can only get a couple of bottles at a time when we get it. So we still would urge people to get something if they can. Relenza is the other product that's out there, and it's an inhaler. But if you have lung disease or milk protein allergy or under the age of 7, you can't use it. So the best product is actually the flu shot. We're still giving the flu shot. We'll probably have enough to continue maybe the next 2 weeks. And by April, it will be expired, meaning that you cannot inject it in anybody after April 1st. So get the flu shot while you can. If you have not received it yet, the one that we're giving is a quadrivalent shot, and it is one that is a lot broader acting than the trivalent shot that we had in the past. So hopefully we're drawing to an end to the flu season. People are still getting it, but the peak, I think, has been here, and we are going to be able to see fewer and fewer people get the flu than we had in the past month and the month before that. So just be aware that they're trying to come out with a new shot that is worldwide, that can take care of the flu and not grow in eggs and not mutate like the one that we have now. I doubt if we'll have it ready by next year. They are hoping to get a shot or an oral dose that will cure you in 24 hours. They have that in China now. It has not been approved in the United States, but we will certainly be on it if they have it. Medical adherence is what we've talked to you about before, about this taking your medicine on time and taking it. If you're a diabetic, make sure you're taking a statin. If you're a diabetic, make sure you're getting your diabetes meds filled on time. If you have a thyroid condition and you have to take thyroid every day, make sure that you're getting it on time. There's a pay per performance thing that for the physicians, if you're going to be compliant, and we are the ones that notify the physician that you're not compliant. And every month it's some of the same people that are non-compliant on some of the same drugs. So we're trying to streamline our efforts to help you take your patients properly. Sometimes you'll get a call from one of our girls, and I had a lady that was in and got 6 prescriptions the other day, and she left off one of her prescriptions for diabetes, and she had left off the same prescription a month ago. So we had to remind her, and we're trying to sync their meds so they're all due at the same time, so we don't give you an opportunity to miss one. The real goal here is a better care for you, good patient care. Adherence to a med regimen can help. They have to be of the appropriate meds, and they have to be safe, and they have to be effective. And you have to be able to get a return on your investment. If you're paying money for these drugs, you need to it needs to make a big impact on your health. Patients targeted by these MTM platforms, that's medical therapy management, or on multiple meds, some of those meds are very costly. Some of those meds are life-saving medications. You need to consider new RXs, a golden moment to start the therapy off on the right-hand foot. And one thing we've talked about before is some of your diseases that we're treating are hypertension, high blood pressure, high sugar, which is diabetes, and they almost call them the silent killer because you really aren't symptomatic unless you're way at the end of the scale with high blood pressure. You're not really symptomatic if you're where you should be with the medication when you're taking diabetes. But what you fail to remember is that you're okay because you're taking the medication. If the medication was taken away from you and that disease is still prevalent in your system, you're going to feel a lot different. So try to be as compliant as you can, whether you feel you've taken it or not. I was talking to somebody the other day that said that was very arthritic because of the weather, and it was at a function, and she said, well, I take Celebrex all the time, but it isn't effective anymore. And I said, I've taken that ever since it came on the market, and then I'm taking it generically, and no, it doesn't seem like it's working as well as it once did, but try one day without it. And I can't pick up a pen, I can't drive a car, my hands just don't work. And so it's that same issue that we talk about quality of life. And that's really how we get into opiate addiction when it comes to quality of life. You've been taught that when you had a major surgery that you're going to hurt. And so they write you a prescription for 120 oxycodone. And you take it, and they're right. You don't hurt. You go back and see the doctor again and write you another prescription for that. Probably won't happen anymore, but that's the way it was happening. So we believe that because the doctor told us that we were going to hurt if we didn't take it. So we just kept taking it, and pretty soon you're addicted. And you're afraid to get off of the opiate because you know that when you get off of it, you're going to start hurting again. Well, guess what? When you go through the withdrawal, that's as bad as it's going to get for you. You don't still hurt from the same thing you hurt from 10 or 20 years ago. I hurt every day. I've had 4 back surgeries, an ankle, a femur, a shoulder. Do I feel like I'm 25 years old? No, I don't. But I don't feel that bad. And the pain that I endure is something that isn't immobilizing to me. It's just a way of life that I've learned to live with. And you can do that in your mind, and it will be just fine. So you'll find most of the people that are trying to adhere to opiate treatment that want to quit, once they start not being able to receive the medication anymore, then they have no choice but to go into withdrawal and get over that. And guess what? They feel just fine. They weren't going to hurt like they did before. So we try to involve the prescribers if patients fall too far behind on refills or don't pick up new prescriptions. And we tell our technicians and clerks to watch for payer alerts for late refills, and then they give it to me. And we try to educate the patient, if nothing else, about how important it is. And sometimes we try to educate the physicians too, and sometimes the physicians just don't accept what we're telling them. If they have somebody on a triglyceride, they don't want to put them on a statin all at the same time. Now, one works for high cholesterol, the other one works, another drug that they're on, like gemfibrozol or Fibrozol, works for the triglycerides. But a lot of the time, physicians want to give the patient less medicine and do not buy into the theory of the Beers criteria that these things need to be given if you have an underlying disease state. And then we have a standard of practice that comes out that says If you're over the age of 70, maybe you don't need to take statins at all, regardless. And so here you have information on both sides of the track that say, one says don't take it if you're over the age of 70. The other one says if you have diabetes, make sure you take this drug also. Whether or not it will do any good or not, it will probably change, as we've said on previous shows. So I'd be very compliant with what the physician asks you to do, because they are the doctor. They know how they feel, and you belong to them. And if that happens to you, you need to tell us that Dr. So-and-so said that I don't need to take this medication. Now, that's not going to dwell well with your insurance company, but it will help you some to relate it to me, because I will relate it to the insurance company, and it's up to them what they want to do about it. It's not your fault. It's not my fault. And the physician doesn't feel like it's his or her fault. So we're kind of stuck on a rock and a hard place. Usually they leave you alone after they see that. They can't override what a physician does unless you're like this physician that was with Aetna that we talked about a month ago, that was being sued because he never looked at a patient's chart. We're going to take a break, and when we come back, we're going to talk about what percentage of Paul's brain does he really use.
Like none.
Many patients with chronic pain end up taking pain medications from many different physicians. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. Each of your doctors may not be aware of the medications prescribed by other doctors, and the result is an increase in the risk of side effects that don't necessarily come with better pain control. The drugs are usually prescribed for pain for a short amount of time, but the length of time can get lost in the shuffle. If you're taking multiple medications, sit down with your pharmacist and review all of them, not just pain medications, but all your medications. Ask us about our medication review program where you bring all your medications into our pharmacist. We will look at all the medications, both prescription and over-the-counter, to check for duplications, expired medications, and possibly discontinued medications. There are no charges for this service, and it's a free service, and you don't have to be our customer. Northlake Medical Pharmacies at Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops Mart in Lakewood.
The Waldorf School of Mendocino County would like to invite you to their 4th annual auction gala. The Enchanted Woodland Ball will take place March 17th at the Willits Little Lake Grange from 5 to 10:30 p.m. Dinner, live and silent auction, costume contest, dancing, and merriment. Tickets are $50 each and can be purchased at MendocinoWaldorf.org or by calling 485-8719.
Who was your hero when you were a kid?
Whether it was Joe DiMaggio or Jackie Robinson,
Rosa Parks or Sally Ride?
Bogart or Brando.
You're just the right age to do something important that you can be remembered for.
Even if you're in your 50s, 60s, 70s, or beyond, you can register to become an organ and tissue donor.
Surprised? You shouldn't be.
Today, people of all ages and even with health conditions can sign up to donate the gift of life.
And it's so important. Every age, every ethnicity is needed.
If we all signed up, imagine the lives we could save.
The families we could help.
So whether you admire John Wayne or James Dean, Robert Redford or Roberto Clemente,
Elvis Presley or Ella Fitzgerald, do something important that could make a real difference and change lives.
get the facts today and register to become an organ donor.
Find out how at organdonor.gov or call 1-866-99-DONATE.
A message from the U.S. Department of Health and Human Services, Health Resources and Services Administration.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Tompkins Tax Consultants. John and Diane Tompkins have been serving Lake County since 1974 and have been a member of the Lake County Chamber of Commerce for 24 years. They provide services to many small businesses and individuals in Lake and Mendocino County. Their main office is located in Lucerne off Highway 20, and they also have a second satellite location in Lakeport at 576 Lakeport Boulevard. For more information, reach them at 274-1843.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back.
Well, you got my name right, Bill. That was good.
Yeah.
Yeah.
I didn't
Well-
call you Paul. Didn't I do that once?
Yeah.
I'm Bill and he's Paul.
Yeah.
Yeah.
Well, a lot of people wonder what percentage of our brain do we use. And how much do you think, Paul? I mean,
Oh, I've heard. I think I've heard something like less than 10% or something like that.
that's the big myth, the
Yeah.
10% myth involving brain function. You know, the brain's the most complex organ in the body, and many people believe that a person only uses 10% of their brain, and I don't know if there's any truth to it or not, but a person's brain determines how they experience the world around them. The brain weighs about 3 pounds and contains about 100 billion neurons, which are cells that carry information. This article came out of Medical News today, and they bust some widely held myths that reveal some interesting facts about the brain. According to a survey that was, I think 5 years ago, or around 65% of the Americans believe we only use 10% of our brain. And sometimes I feel like that's all that's working. But the other day I went out to the car, and I usually have the keys in my pocket, and I didn't have them, and I wondered where they were, and I went through coats and stuff and didn't. And in my head, I saw a picture of my keys laying on the bed downstairs, where I get ready every morning. And I went down there, and there it was. And I thought,
Wow,
yeah,
pretty
that's
good.
really good.
Yeah.
You know, I didn't know how to get to work, but I mean, it was, but it's just a myth about this 10%. The majority of the brain is almost always active. The 10% myth was also debunked in a study published in Frontiers in Human Neuroscience. It's a book that you want to read if you want to go to sleep at night. So one common brain imaging technique called the functioning MRI can measure activity in the brain while a person is performing different tasks. Using this and similar methods, researchers can show that your brain is in use most of the time, even when you're doing just a simple action. So a lot of the brain is even active when a person is resting or sleeping. You know, I swim a lot, and I would like to be able to swim and not think. But I mean, I use that time swimming to think about what I did all day long and what I could do better. And it certainly isn't, the muscles are relaxing by swimming, but it doesn't relax my brain too much. The percentage of brain that you use at any given time varies from person to person. It also depends on what a person is doing or what they're thinking about to start with. And you'll find things that have been bothering you during the day when you finally get home or you go to bed. Those same things are in your mind because that problem hasn't been solved. And you wonder where that 10% myth came from. We don't really know how it began, but there are several possible sources. There was an article in 1907 in the Journal of Science, and there was a psychologist, William James, argued that humans only use part of their mental resources, but he didn't specify a percentage. The figure was referenced to in Dale Carnegie's 1936 book on how to win friends and influence people. That was described as the author's college professor used to say. There's also a belief among scientists that neurons make up around 10% of the brain cells, and that may have been where it came from. So the myth has been reported in several articles, TV programs, and films, which help to explain why it's so widely believed. But you can improve brain function, and it's really kind of affected by your lifestyle, diet, and the amount that you exercise. To improve the health and function of the brain, a person can do some of the following things: eat a balanced diet. Where does that never, ever doesn't show up in one of my radio shows? It improves overall health, well-being, reduces the risk of developing health issues that may lead to dementia, cardiovascular disease, midlife obesity, type 2 diabetes. There are foods that promote just brain health, and fruits and vegetables with dark skins that are rich in vitamin E, such as spinach, broccoli, blueberries. Others are rich in beta-carotene, including red peppers and sweet potatoes. Vitamin E and carotene promote brain health. I had a neighbor that, because my wife had fallen a couple of days ago, prepared a Mexican tortilla soup for us. And I'm telling you, that had most of those items in it. Blueberries, broccoli, peppers, potatoes, beta-carotene, oily fish, and we've heard about this for a long time with omega-3. Salmon, mackerel, and tuna are rich in omega-3 fatty acids, which help brain function. Many believe that a person is either left or right-brained. We'll get into whether that's true or not. Exercise regularly. Here we are again. Diet and exercise, diet and exercise. The same kind of exercises we've talked about, bike riding, jogging, and swimming. Walking briskly for 30 minutes a day can be enough to reduce the risk of brain functioning declining. Keeping your brain active, and we've heard this before with people who are getting dementia or Alzheimer's, the more brain functions they use, the slower it is for them to progress with dementia or Alzheimer's. Brain training exercises are a good way to maintain overall brain health. My mother lived to be 94, and she did crossword puzzles every day. A recent study conducted about over 10 years found that people who used brain training exercises reduced the risk of dementia by 29%. The most effective training focused on increasing the brain's speed and ability to process complex information. If you're doing like crossword puzzles, you see that question at first and you think there's nothing to put in there, and then you're able to do a vertical answer of something and then another horizontal answer, and pretty soon some of those slots are filled with suggestions to make a complete word. And the sooner you recognize that, the more your brain expands. So there's a number of other popular myths about the brain that we just mentioned, the left versus the right. Many think that a person is either left-brained or right-brained, with right-brained people being more creative, and left-brained people more logical. But the research says there is no such thing. People are not dominated by one brain hemisphere or another. A healthy person is constantly using both hemispheres. They have different tasks. For instance, a study in biology discussed the extent to which the left hemisphere is involved processing language and the right in processing emotions. So both sides of the brains are used equally, and so if you can do one, you can do the other. There are things that can damage the brain. Alcoholism, long-term, can lead to a number of health problems, including brain damage. It's not, however, as simple as saying that drinking alcohol kills brain cells. This is a myth. The reasons for this are very, very complicated, but I know that there are people that are alcoholics that can barely say their name, and whether that's from having too much alcohol or whether it's from having concussions or whatever, it isn't normally caused by just drinking alcohol. If a woman drinks too much alcohol while pregnant, it can affect the brain development of fetus and even cause fetal alcohol syndrome. I'm not a bar person. I don't go in a bar very much, but when there's an event or something, or if I'm traveling, I'll walk into a hotel and have a cocktail before I go to bed sometimes. And amazing the number of people that you see that are pregnant that are drinking. And also amazing to see the number of people when you get outside of California where smoking is not as limited that are smoking and that are pregnant. The brains of babies with fetal alcohol syndrome may be smaller and often contain fewer brain cells, and that may lead to difficulties with learning and behavior. So research also suggests that subliminal messages can provoke an emotional response in people unaware they had received those. But can subliminal messages help a person learn new things? And you know what those subliminal messages are. There's something that flashes on the screen and it's gone, and you don't really realize it's there, and then all of a sudden it makes a difference. A study published in Nature Communications found that the hearing recordings of vocabulary when sleeping could improve a person's ability to remember the words. This was only the case in people who had already studied the vocabulary. So if you were learning all new words, this wouldn't be an effective tool. They noted that hearing information while asleep cannot help a person learn new things. It may only improve a recall of information learned earlier while awake. And as you've seen pictures, the brain is covered in folds, commonly known as wrinkles. The dip in each fold is called the sulcus, and the raised part is called the gyrus. Some people believe the new wrinkle is formed every time a person learns something, but that's not really the case. The brain starts to develop wrinkles before you're even born, when that process continues all the way through childhood. So it's constantly making new connections and breaking old ones, even when you're an adult. But there are facts about the brains that are true, and one is energy use. The brain represents around 2% of a person's weight, but uses 20% of their oxygen and calories. Hydration, getting plenty of fluid. First established in 1945, scientists estimate that the brain is around 73% water. Keeping the brain hydrated is important. Being hydrated by as little as 2% may impair your ability to perform tasks that involve attention, memory, and motor skills. You know, I watch a show, not because they're naked, but there's a show on National Geographic that's Naked and Afraid. Have you ever
Yeah, I've
seen that?
seen that show, yeah.
And they're left on an island someplace, and they, with no food,
Yeah.
no clothes, nothing on their feet, and then they have to survive for 21 days.
Yeah.
And as some of them go 10, 12, 14 days, some go the whole time without
Yeah.
any food. And you can see their thinking capacity dwindle
Yep.
when they can't hydrate themselves. And their first effort is to get a shelter built and then find some way to build a fire. And they're always in a jungle or a desert or in a I don't know if any of them have been in the Arctic in wintry conditions
I
or
don't know
not.
if they've ever, in the freezing cold. I don't know that they have. I've seen them when it rains the whole time, but
And I actually learned something from watching that. Well, I know they're not wearing clothes, but you don't see any vital parts. But
they blur it out.
yeah, but I do see them
Hey, I
finding sources of food and
think we got snow going on outside.
really,
It looks like it, or
wow,
or big rain.
big rain that's floating through the air.
Yeah.
So, well, geez, I'm sorry about that.
Fascinating.
Yeah, we're going to get it down here like
Yeah.
they said. See, actually, Paul hasn't had anything to drink, and his brain is hydrated right now, or not hydrated, and he's seeing snow.
Yeah,
and
I
it's
know.
probably flour from somebody's window that they threw out. Cholesterol also is a type of fat that people often consider bad for their health, and too much cholesterol is bad for the heart. However, many people are unaware that it plays a significant role in a person's brain. Without cholesterol, the cells in the brain would not survive. So with all this information, and I just lost Paul to go out and look at the snow, just like a little kid, because of the organ's complexity, scientists and people such as me that are still learning about the brain The notion that a person uses only 10% of their brain is definitely a myth. An fMRI, which is a MRI of the brain scans, show that even simple activities require almost all of the brain to be active. There's still a lot to learn about the brain. Researchers continue to fill in the gaps between the fact and the fiction. So some little worthless information to learn about how your brain functions and how much of it you use and what is good for it and what isn't good for it. You know, we talked about blood pressure monitoring the other day, and there's a few things that we kind of left out about what you should do to get the best blood pressure. And I got an article that was on Omron, a company that makes blood pressure monitors. And was that real snow, Paul? Well,
Yeah,
kind of.
kind of, yeah. I mean, not anything that, you know, is sticking or anything.
The
but-
buses are still running.
Yeah, yeah, everything still seems to be normal out there.
So any of you folks that are listening that aren't from here, we get a few flakes of snow, and all of a sudden it's
Oh, the whole world just collapsed.
it's a snow day, and you can't. So instead, we're going to talk about your blood pressure. So,
Yeah, well, snow makes my blood pressure go
yeah.
up.
Well, to get a good feel for your blood pressure, use your monitor twice a day. Measure in the morning before you eat and take your medications, and again in the evening. It's best to do it at the same time every day. While you really should use your blood pressure monitor in the morning, don't do it as soon as you get out of bed. Start your morning routine, such as brushing your teeth or taking a shower, but before you take the day's first reading. So make sure to measure your blood pressure before you eat breakfast or take any medication. So get up, do your treadmill, do whatever you need to do, brush your teeth, get going, and find out what it is. Avoid taking your blood pressure less than a half hour after working out. The reading likely will not be accurate. If you're on a medication like a beta blocker that I'm on, it takes an awful lot to make your heart race and increase your blood pressure, because its job is to keep your blood pressure at a normal rate. So any times if your physician asks you to do a stress test and take your blood pressure, they will tell you not to take your beta blocker that day because it won't work. Don't eat any food or consume caffeine, tobacco, or alcohol for an half hour before you use your blood pressure monitor. I had a person in the other day that needed their blood pressure taken, and I took it. And then he told me he had just had a cup of coffee. But his blood pressure came out exactly what he thought it would be, and he had waited long enough before the coffee had an effect on it. While you're taking your blood pressure, stay still and quiet. Make sure you're as comfortable as possible and remain calm to get an accurate reading. And we told you what to do in that situation. Keep both feet on the ground, sit at a table, put your arm out level with your heart. If it's not level with your heart on the table, put a box or something underneath it to make it approximately level with your heart. Your palm up, no talking. Pump it up to at least 20 to 30 points higher than your systolic normally runs. That's the high blood pressure. So if you're normal at 130, you want to go up to 160 before you let it start coming down. If you don't give it at least 20 spaces in between, it will error out, and that's why. When you put the blood pressure monitor on, make sure you have that microphone over your brachial artery, which is right on the other side of your elbow and going up. Always measure your blood pressure using the same arm. Rest the arm on a table at heart level, just like we said. Place your blood pressure monitor cuff against the bare skin. Securing it over clothing can affect the result. Now, what may confuse you here is when you go into a doctor's office, they will take it over your shirt, and you wonder why they do that. Well, And some of them will use the same monitor that you use. Whenever you use a blood pressure monitor, you have to take 2 to 3 readings, waiting for a minute or two between each. I say actually 5 minutes to let those blood vessels expand, and that allows you to verify the accuracy of the readings. Now, when you go and do a little research on why they can take your blood pressure with the over your clothing, they use a stethoscope to listen to your heart rate and your systolic and diastolic. With an electronic blood pressure cuff that it does its own reading with a microphone that's next to your skin. So what they're doing, if they do it properly, may be a little bit different than what you see on the monitor when they do it, because they're actually listening to your heart rate through a stethoscope, which is also a microphone, but it's much more refined than the one that we use on the electronic cuffs. So just be careful about thinking maybe they're not getting the right blood pressure. They really are. A lot of people during this flu have had trouble breathing because their lungs are filling up full of fluid, and a lot of people are getting rescue inhalers. And when somebody comes in and says, I want my inhaler, we will ask you whether you want your rescue inhaler or your steroid inhaler, and many people don't know what we're talking about. Well, a rescue inhaler helps to expand a person's airway during an asthma attack or any kind of a lot of times before exercise, you use a rescue inhaler. It's used to reduce the symptoms. A person having an attack should use the rescue inhaler, and a person with asthma should carry a rescue inhaler at all times. Relief really from an attack is the chief use. According to a recent estimate, the American College of Allergy, Asthma, and Immunology, 26 million Americans have asthma, and a long-term condition that affects the lung and airways. During an asthma attack, the airways swell, and this makes them narrower, causing a person to cough or wheeze or have trouble breathing. It delivers the medication that expands the airways and relieves those symptoms and helps the person to recover. They may also use a rescue inhaler before a workout to prevent an attack. Sometimes we'll see instructions on the container that says take 1 or 2 puffs every 4 to 6 hours as needed to prevent cough or to assist breathing or for wheezing. A person with COPD, which is chronic obstructive pulmonary disease, may also benefit from using a rescue inhaler. Not as much as an asthmatic would, but they found, a study in 2016 found people with COPD experienced relief from severe symptoms after using several different types of rescue inhalers. So the beta agonists are the big ones that open up the blood vessels. There's also anticholinergics, which slow down the secretions that go down into the lungs, and theophylline, which is usually a pill or a liquid that you take. The problem with using inhalers is not using them properly. We had a person yesterday that had had the inhaler 12 days. It's supposed to last 28 days, and he was out of it. We suggested that he call his physician and tell his physician how he was using it, and let him decide whether or not they were going to give him another inhaler or not. These are not supposed to be a cardiac effective thing. They're not supposed to affect the heart, but some of them do, especially the ones that you get over the counter that can be epinephrine. But the ones that you get on prescription usually cannot. So inhalation is the best way to treat it. Most of them, although some of them are coming out now, that you don't have to shake, but albuterol, which is ProAir or Ventolin, is a short-acting medication commonly used in inhalers. You need to shake the inhaler up. You need to open up the cap. You need to shoot the medication into your throat, swallow it, hold it in your lungs for at least 10 seconds, and then let the air out. Wait a minute or two before doing that same process again. If it says take 1 to 2 puffs every 4 to 6 hours, you wait a minute between the puffs and hold it as long as possible. If you just go squirt, squirt, you're going to get about 10% effectiveness from that inhaler, and it's not going to work. And that's what people are doing that are using it too often. This article that came out of Medical News Today says if you're using it more than once every 12 hours, you need to talk to your physician. I have very, very few prescriptions that a prescription for a rescue inhaler isn't specified every 4 to 6 hours is needed. It's usually every 4 to 6 hours is needed and 1 to 2 puffs, and never is it every 12 hours. I'm not saying that's not an effective way to use it, but it depends on what you're using it for. Most of the people here that are using asthma inhalers and rescue inhalers are older. They have an acute kind or a chronic kind of a condition that makes them use a rescue inhaler as well as a steroid inhaler. The reason we don't use the steroid inhaler and rescue inhaler all the time is that they come as a combination in some of these inhalers that people use. So in order to give them the best results, you give them the combination. Now, it takes it a little bit longer to be effective, and it works. You usually take it once to twice a day, depending on the inhaler. So you need to pay a lot of attention if you're just beginning to get on these medications on how to use it and use it properly, because they're changing all the time. They're coming out with new ones that are different strengths, new ones that are in capsules that you have to crush the capsule to get the product out of there. Instead of shooting it into your lungs, you have to breathe it into your lungs from the inhaler. The takeaway with all this is in a person with asthma that experiences any kind of breathing difficulties should use a rescue inhaler, and it should always be close at hand. A symptom of an asthma attack following the use of a rescue inhaler, a person may require emergency treatment in this event, meaning it wasn't effective or they didn't take it effectively. It's only intended for use, this says during an asthma attack, but it's also used as a preventative for an asthma attack and to relieve symptoms. If a person needs to use their inhaler more than twice a week, they should speak to a doctor. The doctor can review methods of asthma management and come out with a plan. I really don't think that that's actually necessary, but because I don't see very many people using it only twice a week. But do as your doctor tells you, and just be reminded that we're always here for you. I can't even get that sentence out. I'd like to remind you we're Northlake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192 or outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM KXPX Lakeport.